We'd like to thank you all for tuning in today and coming back. We're, as we've done in the past, but not real recently, going to focus on another area in the pandemic that isn't about viruses, but it's about the effect of the pandemic on the workforce. And so we're really pleased to have Acting Secretary Ricky Cerna here with us today, and he's going to walk us through an overview of what we're looking at as federal benefits wind down and we work to bring New Mexicans back to work. And with that, and without any further ado, Ricky, take it away.
Thank you, Dr. Strace. I appreciate the introduction and more importantly, the invitation to join you this afternoon. I look forward to the updates, sharing updates and answering any questions that may come. Great, thank you. I think this first slide is important in kind of setting the stage for the presentation, at least mine today. You'll see here what unemployment rate is done going back several months to January 2020, how we fare relative to the rest of the nation and where we were as recent as last month, August of 2021 at 5.2. In a little bit, I'll show these rates by county. I think what's important to underscore here is that there is, to be sure, a correlation between the number of New Mexicans on unemployment insurance benefits and the total employment rate, but it's not a direct correlation. I'll give you an example. The official unemployment rate and the number of unemployed is really based on the current population survey that's administered by the Census Bureau on a monthly basis. So certainly there are individuals who are not working that aren't currently receiving unemployment benefits. So that's a direct instance, right, in which the number of claimants doesn't necessarily reflect the number of those who are currently unemployed. So if you'll go to the next slide, please. Great. On this slide here is a representation of unemployment insurance claimants over a period of time going back to 6/7 of 2021. It's important to note here that on each day on this graph, we're taking a 3-week look back on total claimants by program. And we do that primarily because there's a lot of changes that occur with a single claimant over a short period of time. And so this gives us a better sense of where they ended up programmatically and whether or not they're counted here as a claimant who is in fact receiving benefit payments. Just to kind of recap, in June of 2021, the Department of Workforce Solutions was paying about more than 77,000 claimants on multiple programs. Then if you take a look at August 30 of 2021, this date is important for us because it represents the last full week prior to the expiration of federal extension benefits. So on August 30th, about 67,000 claimants were receiving benefits. Shortly thereafter, on September 5th, we had multiple federal extension programs expire. They included Pandemic Unemployment Assistance Program, newly developed to assist self-employed gig economy workers. Federal Pandemic Unemployment Compensation ended. That was otherwise known as the $300 a week supplemental payment to individuals eligible for a program. Pandemic employment compensation provided additional benefit weeks to claimants. And then finally, mixed earners unemployment compensation provided an additional $100 per week for those who were eligible for both W-2 wage work and self-employment work. So in total, about 50,000 claimants came off program eligibility on September 5th. And so now on October 4th, again, looking back 3 weeks, we have just over 18,000 claimants on benefits over that 3-week period. Just over 10,000 of them on standard unemployment benefits, which is what the department administers under all normal circumstances. And then about 7,500 of them are receiving benefits on federal extension benefits too. And the state is required to offer federal extension benefits as a measure when our unemployment rate reaches a certain level. Next slide, please. This again, this slide again represents how we're doing right now relative to the US in terms of a seasonally adjusted unemployment rate. The next few slides, in fact, I'm going to show is going to represent data that's certainly driving decisions for us at the department, specifically in the area of employment and reemployment services and priorities. As you'll see here, in July of 2021, the unemployment rate for the state was 7.6. It's dropped to 7.2. And over the past year, August 2020 to August 2021, it's come down by 2.1% compared to 3.2% nationally. And so, beyond claims by workforce region, we're looking for trends, right? Not just are we looking to see what regions of the state are doing well relative to claimants coming off of unemployment insurance benefits. We're also looking at various other indicators that might suggest we need to provide additional services, for example, to females versus males, certain age groups, and then certainly we're looking at data based on educational attainment and the impact that the economic downturn had on them. Very quickly here on this slide, we're looking for resiliency by region, and you'll see that the central region has seen the highest decrease in total claims over the period August 4 to October 4th. And so they're down by about 72.8% of claimants receiving in those counties. Our data is suggesting that the Southwest region is struggling a little bit more than other regions across the state to reduce percentage-wise the number of individuals receiving benefits. So that kind of coincides with what you'll see on the next slide, which is the unemployment rates by county. On this slide, what we're showing you is the state rate broken down by counties. And so you'll see that in that Southwest region that I pointed to earlier, we have counties that not just on the heels of the recession, of the most recent recession, but historically struggle with high unemployment rates, including Luna County, Grant County, Hidalgo County. So we certainly are looking at ways that we can assist those communities, specifically with increased job opportunities is really a barrier that we're trying to overcome with them to reduce that unemployment rate and in turn change the rate for the entire state. It's important to note here that New Mexico traditionally struggles with recession or economic downturn recovery, and that has a lot to do with our industry mix and our need to kind of diversify in terms of industries that are providing jobs. For example, the 2009 recession in terms of total employment took 9-10 years to recover. We saw about 4 or 5 very strong months before the pandemic hit. So we've got some work to do. I think there's going to be a time period that we're going to see how the pandemic impacted this economic downturn relative to other recessions. It is also important to note, because of the amount of federal jobs and resources coming into the state, New Mexico does okay relative to other states during an economic recession. So although the impact isn't as great relative to other states, it's important to note that our recovery will take several months. Another thing to note, of course, is this is in part due to our governor's leadership in ensuring that our economic recovery is calculated, and that what we're doing also economically is also working in parallel with what we know research and from a public health perspective. So those are important factors that don't typically come into play during a normal economic downturn. Next slide, please. Another bit of data that's very important to us is understanding how industries are bouncing back from an economic downturn. This slide right here is using data from Claimants 3 weeks back from October 4th. So what we're looking at here on this pie chart is a distribution of UI claimants based on the last occupation they were working in prior to receiving benefits. So the occupations with the largest percentage and decrease of claims since August 2nd include art and design, education and training, personal care, So what we're looking at, of course, is an understanding of where we need to provide additional support. Unfortunately, what we cannot do at this time is understand whether or not these workers are going back into that last occupation or if they're pivoting professionally and moving into other industries. Once employers begin to report wages for the quarter that ended in September, we'll get a better sense of where these claimants ended up in terms of an occupation and industry and whether or not there was mobility from New Mexico to other states. So right now what we're doing is looking to see what industries and occupations are doing well, which are not, and where we need to focus our assistance for employers getting workers either connected with them directly or getting workers cross-trained and skilled up to do the work that they're looking for them to do. Next slide, please. I think it's important for us to share the health of an update on the health of the trust fund. Here, this slide right here shows the health going back to July 12th of 2021. As you all may be aware, the UI Trust Fund was impacted significantly as a result of the pandemic. Again, thanks to Governor Lujan Grisham, the trust fund was restored to pre-pandemic levels at the end of June 2021. And you'll see here beginning in July that the health reached early 2020 fund balances. Right now, of the total claimants we have accessing benefits, our regular state unemployment insurance benefits are certainly being paid for from the fund. Of those claimants that are on federal extended benefits, 50% of their weekly benefits are coming from the trust fund, and the other 50% are being reimbursed by USDOL. So we certainly have been monitoring very closely the trust fund. The balance does play a significant role in unemployment insurance tax rates for employers. Those rates are currently being calculated, and we'll release them to employers in November, keeping in mind that there'll be some data omission requirements that we'll continue to put into place to further help employers that saw benefit charges over the course of the pandemic. Next slide, please. Something that we've been struggling with over the past couple of years has been fraud, unemployment insurance fraud. And certainly this has not been limited to unemployment insurance claimants. I think several New Mexicans, those that have never filed a claim before in their work history, have intersected in some point with some sort of scam that's attempted to obtain their personal information, identity theft, etc. So we wanted to be sure to put a slide in here to remind everyone of a couple of things. First of all, one of the most foundational requirements for unemployment insurance claimants is that they are actively seeking work and able and available to accept suitable work if offered. So if you're an employer or if you're aware of someone that is not complying with that requirement and is receiving unemployment insurance benefits, this link here, which is our website /report refusal of suitable work, that's a place on our website where you can report a claimant for not accepting work. And of course, then there would be an adverse impact to their benefit eligibility. We want to remind everybody that fraudsters continue to use tools like text messages, emails, and phone calls to obtain information either about your claim, if you are a claimant, or to obtain private information that might otherwise be used to file a claim. So beginning end of July, the Department of Workforce Solutions stopped using text messages to communicate with claimants. So if you do receive a text message indicating that there's information they need for your claim, don't be alarmed. Please don't click on any of the links that text message might provide for you. We will not use text messages to communicate with you if you are a claimant. And if you're not a claimant, and receive a text message, they're phishing attempts, and a claim has not been filed on your behalf. Emails and phone calls are also being used, and so if you do get an email or a phone call and you're unsure if those are coming from us, do not ever give out social security numbers, passwords to any accounts, UI or otherwise, or any personal banking information. So our staff will never email a claimant or a New Mexican and ask for a social security number, a password, or any banking information. So if you're being asked for that, then you know it's a scam, and please respond and certainly don't access any links. There are other forms of unemployment insurance fraud that we want to bring to your attention and ask for your help with. Again, UI claimants are required to conduct work searches every week that they certify for benefits. If you're aware of individuals that are not doing that in a sincere way, if you're aware of individuals that are receiving benefits and not reporting cash wages, or individuals who are victims of, or who are using identity theft as the tactic for obtaining fraudulently benefits, please use the link provided there, which is our website /identity theft, and we'll quickly capture information that that's necessary to investigate those individuals, and certainly to stop benefit payments from going out on fraudulent claims. Next slide, great. On this slide here, shifting gears slightly, certainly the focus of our work since September 5th has been primarily on getting New Mexicans back to work. So we're really trying to understand, where job vacancies are across the state, the kinds of skills and education and training necessary to do this work, and then of course the unemployed workforce, and identifying the gap and how we can close it so that these individuals can become qualified for these jobs. So you'll see here at the very top, healthcare and social assistance, over 13,000 job openings, educational services, and all the way down to wholesale trade, over 1,200 vacant open positions that are being advertised anywhere online for New Mexico. You'll see that change over time, going back to 2008, from just over 40,000 jobs to more than 80,000 jobs. And it's important to note that in just the past year as well, New Mexico has seen job growth, over 30,000 new jobs in the state of New Mexico. And so we're certainly identifying with individual employers and understanding what they need and making direct referrals and connections. And I'll share an example here. It has been a major priority for us over the past several months to really focus on helping tourism and hospitality related employers. And we're working closely, the department is working closely with tourism department, ECD, Early Childhood Department, and Economic Development Department to really craft strategies that will help restaurants and hotel owners and ski bases really ramp up and identify with workers that will meet their minimum qualifications and experience history. And so this is just one of several measures that bring agencies together to work with employers to really connect them with the kind of workforce, but more importantly, to also help that workforce overcome barriers. For example, providing childcare assistance, assisting employers with developing after school tutoring spaces for children of their workers so that they can continue to work. So we're working very closely with various employers. In fact, just yesterday, we met with several hotel and restaurant owners across the state to really float some of the tactics that we have in mind and get their feedback on how effective they believe they'll be. And in addition to direct hiring and local hiring initiatives, we expect that we can do some things to really lift the financial cost that's coming with ramping up quickly. So we look forward to being able to report on the outcomes of some of those measures. Next slide, please. The New Mexico Workforce Connections offices are really one-stop shops and hubs for New Mexicans. We have 23 workforce connection centers across the state. The best way to describe these centers are really one-stop shops where job seekers and employers come for whatever assistance they need to get to work, or to do work. So over the last several months, we of course have been doing things a little differently. And right now we're engaged in a whole lot more direct hiring events for employers and communities. And that means that we're getting out to communities, meeting with employers, some of them specific to an industry, some of them entire communities. For example, we'll be in Roswell later on this month to meet with several employers to talk about what their recruitment and hiring challenges have been. And prior to that discussion, we'll do some marketing so that we can better understand, right, what the workforce pool looks like. And then after we meet with them, we'll start having direct hiring events in those communities. We'll leverage the information we have about workers that were on benefits prior to September 4th expiration of federal programs. We'll be using data that we have right now with claimants that are currently receiving benefits, and our staff will be able to do outreach to those claimants locally, align their skill sets and previous work experience with what these employers are looking for, and really make those direct connections. Our offices, our workforce connection centers, provide in-person services, and that includes a space and computer lab where job seekers can come in and log into our job system and look for work. That includes direct career counseling, whether that means assistance with resume development, interview skill development, letter of interest development, and overcoming any other barriers like childcare, transportation, or other supportive services that are necessary to really get New Mexicans connected with work. For employers, we're doing a tremendous amount of applicant recruitment and customized screening, which means that not only are we using our workforce connection online system to help promote your jobs, but when workers come into our system, right, we're able to match them with what you're looking for. And in some instances, an employer may request that we conduct initial interviews. They may request that we conduct initial, pre-employment screenings or tests. So we can do that work for you all as employers to be sure that not only are we leveraging the data we have on job seekers, but this is also something that one less thing that employers have to worry about as they're ramping up, right, and really starting to see economic recovery. We also at the Department of Workforce Solutions manage a very robust job system for both employers and job seekers. That system, of course, is the system that provides access to those 80,000 plus vacancies that we shared in a previous slide. We have a resume builder there that is used like a virtual recruiter, which means that we push notifications to job seekers when a position becomes open in their region. It connects them and matches them with minimum requirements and a job seeker's skill set, past employment, education levels. So for employers, it'll do the same. It'll push notifications when a job seeker is into the system and matches with a vacancy that you currently have. So we certainly hope that job seekers and employers will leverage those tools in addition to the others on this slide to really close the gap in workforce. And the website address is here again. Our DWS website /job seekers will get you to that tool where you all can register to access those resources. Next slide, please. Over the past several months, again, we've been working with other agencies, namely the Higher Education Department, to launch a project we refer to as Ready New Mexico. We anticipated surely that as the economy reopened, that a number of workers across the state were going to need, a combination of resources to really overcome barriers and other challenges to getting back to work. And some of those barriers were going to include, retraining, retooling, obtaining skills they didn't have previously, information about childcare assistance, updates about COVID safe practices, and things like that. And from that came the website ready.nm.gov, which really centralizes, right, the job search functions by county. What we've done is actually developed a fund that supports post-secondary institutions in developing short-term boot camp training opportunities that prepare workers for jobs that are currently vacant across the state. We connect you with adult education services, post-secondary programs from certificate programs through baccalaureate and graduate degrees. It's a one-stop shop that also includes information about financial aid, apprenticeships for employers. It's how you access our workforce connection centers for hiring assistance. And all of this information, of course, is wrapped around by data on labor market, jobs outlook, careers outlook, so that we know that the decisions we're helping job seekers make is really rooted in an occupation or a career pathway that is promising for the long term. This project also yielded a toll-free number. So you saw earlier in the map workforce connection centers across the state. This toll-free number here, 800-303-3599, is actually the number that'll get you connected with a career consultant immediately. So whether you're an employer, a job seeker, calling this number will get you connected with one of our career consultants across the state. And whether we move you to an in-person appointment, whether we move you to a virtual discussion, we can get you connected very quickly to someone no matter where they're at. And by doing this, not only have we made it more easy to access our services, but now we can provide better access to communities where there isn't a workforce connection center that one, might have to drive, miles to visit. So the ready.nm.gov has centralized a tremendous amount of resources for employers and job seekers, and we've actually now been able to utilize the toll-free number and the site's live chat feature to expand access to career consultations and business outreach across the state. And so we certainly are tracking the activity and the referrals that we're making through this project, and we look forward to helping you connect with employers or connect with job seekers. And I think that wraps things up. I'm going to turn things over to Dr. Strace, and he'll introduce the next presenter. Thank you.
Yeah, thanks so much, Rick, for bringing this valuable data, and also hoping that our media partners will find a lot of interest in the data, the increase in jobs, the fact that there are a lot of jobs out there for folks. We're going to move into our COVID segment next with Laura updating us on vaccines, and I'll do my wrap up on cases, hospital use, and treatments. So Laura.
Okay, great. Thank you so much. Hey, welcome everybody today, and really glad to be here today to give the vaccine update. So here's our vaccine progress update. This is amazing because 80.4% of New Mexicans 18 and over, as well as 64.4% of 12 to 17-year-olds have received at least one dose. That is amazing. And then 71.1% of New Mexicans and 55.3% of 12 to 17-year-olds are fully vaccinated. So we're so excited about that because the more we vaccinate, the more we keep people from getting sick. We keep our kids in school, keep our economies open, and keep people out of hospitals. So we're excited about that. Next slide. We are worried though still about people who are still not vaccinated and at risk. At the Department of Health, we do track based on race, ethnicity, and also social vulnerability index. This just shows that Hispanic and Latino populations, as well as African American populations, are less vaccinated than the 70%. So we want to keep on working on that, different ways, working with all of you in the community to keep on helping people gain trust and feel comfortable with the vaccine. Next slide. This is a pretty cool slide. The darker shows higher vaccination rates. So you can see New Mexico is kind of like a little island here in the United States, and you actually have to drive all the way to the Northeast in order to get to another place as vaccinated as New Mexico. So good job, New Mexico. Next slide. So here's our booster dose updates. October is going to be a really busy month. You can see here we're on the 6th, and the Vaccine and Related Biological Products Advisory Committee, that's a long name, people just call it VRBAC. On October 14th, they're going to be discussing about whether or not that we're going to get a booster for Moderna. The next day on the 15th, they're going to discuss the J&J booster, as well as whether you can mix and match, meaning that if you got a Pfizer, could you get a Moderna booster or vice versa? Same with J&J. And then on October 26th, they're discussing the EUA for 5 to 11-year-olds. So get ready, New Mexico. There's going to be a lot going on with vaccines this month. Next slide. One of the exciting things, I think, especially for kids and those of you who have little kids and you're worried about them, per the press release from Pfizer, Pfizer just submitted trial data to the FDA on September 28th. There were 2,268 participants 5 to 11 years old, and they showed that the vaccine was safe and effective in children. That's one of the things we really want to make sure that our kids have a safe vaccine. If the FDA approves the EUA, it's likely to be that we start vaccinations for kids in late October and early November. The actual trial data is not available yet, but the one exciting thing, especially for those out there who are pediatricians or family physicians, is that we're expecting longer refrigerator storage time for these vaccines and smaller numbers of vials per order. So you could actually give it to the kids in your practice, and yeah, and that's how a lot of kids get their vaccines. So thanks to all of you out there who are vaccinating our kids. Next slide. One of the things we do want to start thinking about is really who is willing to vaccinate their kids. And this was a hypothetical survey that was sent out to parents asking them about 5 to 11-year-olds, would they get them vaccinated right away? And you can see for children ages 5 to 11, in July of 21, it was 26% of kids. And now we're at 34% of parents who are willing to get their 5 to 11-year-olds vaccinated. So that's really exciting. I think we're going to see more increase when we actually have the vaccine ready. And what we're working on, what our team is working on, and what we hope all of you are looking at too, is that light blue group, people who are going to wait and see to see if we can kind of share with people, gain trust in the vaccine, answer people's questions. We're also going to have a speakers bureau. So if anybody is interested in helping support us, to have town halls to let people know and just really answer questions for parents, because it's understandable for parents when there's a new vaccine to be hesitant. But what we've seen is that it's very effective, and still children are getting sick with COVID. Not as many get hospitalized, but they still can get hospitalized. Some can die. So we'd still want to protect our kids. Next slide. Here we also see that 12 to 15-year-olds who had received their first dose, Hispanic and Latino populations are at 35% of kids getting vaccinated, African American at 52%, and then the other groups are white and American Indian at 76 and 77%. So we still want to keep on answering people's questions, building trust, and getting our kids vaccinated when we can. So that's still our first priority, is getting those first doses in. Next slide. This is our update on the booster dose eligibility. So like we shared last week, we wanted to make sure that people who are older, people who are 65 and over, there's very few in residence and long-term care facilities, but 50 to 64-year-olds with underlying medical conditions, if that group could get vaccinated first and give people some time. But what we've seen is that we didn't see the big stampede we saw when we had new vaccines. We actually saw a slower uptake. So we are opening it up to all the Mays, people who might also are eligible, 18 to 49-year-olds with underlying medical conditions, and 18 to 64-year-olds in high-risk occupational and institutional settings. And just a little shout out, today we opened up a new vaccine site for people experiencing homelessness. Thanks a lot to our Northwest region, Jody Wagner and Erica Flores, who helped us get these vaccines set up. And they had extra vaccines because only 8 people got vaccinated. Only 4 people got vaccinated. There are 2 more doses left. So I took one of them. I got vaccinated today because I am over 50 and I have an underlying medical condition and I feel great. So those of you who are interested in getting a booster, go for it. It was fine. Next slide. Here's our booster dose data. So we had over 31,546 doses given since August 1st. So that was when we had the additional dose for immunocompromised people approved. That's the group that can get Pfizer or Moderna. And then we have people getting those doses. And then after 9/24, which was when booster doses were approved, there were 21,081 doses given since the 24th. So that's great. Next slide. We were worried of whether primary doses, more boosters were going to be given than primaries, but you can see that The week before the booster dose was approved, we had a lot more primary than booster doses. And then the next week, we had a little bit less primary and more boosters. But we think people are still getting their primary doses. So we want to keep on encouraging people because that's the best way to prevent hospitalizations and deaths. One of the things people were worried about is that third dose can be worse than the second dose. And the data from the CDC shows that actually second dose side effects can often be more intense than the first dose, but the third dose side effects are very similar to the second dose. And it's really a sign that your body is building protection, and it tends to go away in a few days. And these are just some common side effects. I have a little bit of pain in my arm, but that's about it. Next slide. So Dr. Fauci recently shared how the booster dose really does provide further protection against COVID from severe disease. And he comments that 12 days or more after the booster dose, this is a study in Israel, that the rate of confirmed infection was lower in the booster dose group than the non-booster group by a factor of 11.3. And the rate of severe illness lower by a factor of 19.5. So just a little bit more evidence that shows that, if you are in the should group, the booster dose can be effective. Next slide. Once again, full vaccination is still our first priority. And this is some great evidence that just recently came out with the Health and Human Services Department, showing that the COVID-19 vaccine once again saves lives and prevents hospitalizations and reduces infection in seniors. And this is so important because prior to the vaccines, 85% of the people who died of COVID-19 in the US were over 65 years old, and they now show really clear evidence in seniors with Medicare that vaccinations were linked to a reduction in COVID of over 250,000 COVID cases, a reduction in 100,000 hospitalizations, and 39,000 deaths among seniors. So we're really saving lives when we give the vaccine. Next slide. So if you haven't been vaccinated or you want your booster, schedule your vaccine appointment at vaccinenewmexico.org today. Talk to your provider if you still have questions about the vaccine, or talk to your friends. Schedule your vaccine appointment with either your provider or a pharmacy, or either on our app at vaccinenewmexico.org. And remember, you can get your flu shot at the same time as your COVID booster. Next slide. We do have our call center, and it really is, we encourage all New Mexicans who have access to internet to use the vaccinenewmexico.org and only use the call center for scheduling if you don't have access to website. The reason we stood up the call center for the scheduling is really to advance kind of vaccine equity by supporting people that don't have internet or don't have the capacity to schedule online. We do Spanish speakers on option 3 or 9. And like I shared last week, it's 8 a.m. to 8 p.m. Monday through Sunday, every single day. So we really want people who have difficulty getting online to really use our call center. Next slide. And then once again, a plea to all providers who can get the vaccine to really sign up in our takecarenewmexico.org website. We're available to help you out. It's a good timing to get your flu and COVID again. Once again, just sharing that again. And medical providers, you guys are the #1 trusted source for vaccine advice. And yeah, we have smaller packages up to 10 weeks in a refrigerator. And we just thank all of you for all you're doing for New Mexico. And good job, everybody. And I'm now going to turn over to, and I just also want to give a shout out to our amazing vaccine team that has been out there working all this data and putting together a plan for our 5 to 11-year-olds. And I want to turn this over to our amazing secretary, David's Grace. Thank you.
Thank you, Laura. Thank you, Ricky. I did want to just mention, I think it's a testimony to leadership that Laura had the option of getting a booster today at 4 hours before a press conference and didn't think twice, just got the shot. So I'm scheduled to get mine this evening after the press conference, because that was the only time I could do it. And we do encourage people, particularly with risk factors or older. I like the way Laura said she was over 50. So I'm going to say that too. I'm over 50 and encourage you to really think about getting the vaccine. Next slide, Brianna, please. This is our typical case curve, and we have some explaining to do today about a trend that none of us really like. This is the number of cases per day, averaged over 7 days by the date of specimen collection. This was our big surge last winter in the middle, but now we're out way over to the right. And you can see our Delta curve went up pretty steeply, and it's not coming down. In fact, it's plateaued. It's really pretty much a flat line, and that's a big problem for New Mexico, New Mexicans, and our hospitals. In the next slide, we blow up those last 4 or 5 weeks into just, so this starts August 24th, and you can see this trend line here is about as horizontal as it could be. This gray area, you know, we backfill these as we get additional test results, so ignore that, but we are not decreasing the number of cases, and that's a huge problem because of the state that our hospitals are in and have been in all this whole time. Next slide, please. The state is a little bit redder than it was last week. Not that it could get that much redder than it is now, but you can see it's a little bit redder. And so only DeBaca and Los Alamos have substantial spread. The rest of the counties in New Mexico have high levels of spread. And given that we're hoping to get down in that second column from the right, total cases per 100,000 persons, that needs to be pretty much below 14 to turn orange, and in the 7 or 8 range to turn yellow. And so we are a long way away, and with some of our smaller counties having really high case rates right now. Next slide, please. On testing, a little bit more bad news. We did a great job increasing our testing to keep up with a high test positivity rate. The green line is our target, which is now at 7.5. And again, looking to the right side of the curve, we were above our target. New Mexicans responded by being more aware and getting more testing. And if we could point out that right end of the curve there, we came down below the green line, but just yesterday went back above it on a 7-day rolling average. So again, significant emphasis here on being tested. When we get above that green line, that means we don't really feel confident we have a handle on all the cases here in New Mexico. And so we'll go through those guidelines in a second. Next slide, please. On the other hand, some good news. We're down to another new record low turnaround time for test results. You can see there all the data is here, but that 1.29 with the green explosion around it, green being good, we're doing well there. So test results coming back much quicker. If you're looking for just screening testing for work, Vault is a good option where you can do it on a Monday and get the results on a Friday and have those to allow you to continue to work another week. So, but nonetheless, great turnaround times. And we want to thank all of the labs listed here for doing such a wonderful job getting those test results in. And you can see from the beginning of the pandemic, well, that's not true. Since December, our average turnaround time was 2.62 days. And, it's about, 2 days and 14 hours. Now we're down to 1 day and, something like 3.5 hours, something like 6.5 hours. So that's great progress, and means we get our results back. We can continue to isolate if we're positive and do that contact tracing even quicker. Next slide, please. So reminder, get tested if you have symptoms. If you don't have symptoms, but you were in close contact with someone who turned positive, or you work in a high-risk situation, and you think that there's sick people coming to work, which shouldn't happen. Just regardless of your vaccination status, a lot of people are still telling me that I'm vaccinated, so I don't need to worry. That isn't true. We had new data, as you all know, from Massachusetts back in it was July. And so please consider it your responsibility to get tested if you're suspicious, if you're sick, have contact with someone or suspicious you might have contracted coronavirus, because you can spread it to other people without knowing you have it yourself. Next slide, please. On the hospital front, things also not very positive. We continue to skate along this line of crisis standards of care, but the fact that this is going on at this level is becoming incredibly stressful for hospitals. We talked in July about an impending nursing shortage, which became clearly a factor in August that has persisted. The state is making some efforts to contract for bringing more nurses into the state, but the problem is that the national nursing pool is very, very lean right now. And so even the agencies we can contract with to bring new nurses don't really have a lot of nurses that they can send us. Prices per hour for what are called traveler nurses or traveling nurses have skyrocketed. And so our hospital personnel are incredibly exhausted, discouraged, and frustrated, frankly, that they are now managing a pandemic and working extra shifts and endangering their own health for what has become a preventable illness. I'll show you some of that data, the latest data, in a minute, but this is really a serious problem and a serious crisis, and we've got a little news clip we're going to show you in a few minutes that illustrates that. Next slide, please. Again, 17 available ICU beds in the whole state. Those fill up every day. And so by the end of the day, we usually have 0 or 1. And medical beds, a little bit better. We were around 50 some. Last week, we're up to 67. But still, it's a major crush to our hospitals, trying to manage so many people. Hospitals still expanding, taking care of people in the hallways, and still having to figure out how to get people needing critical care to the right situations, which is not always possible, as we've been saying for weeks. Next slide, please. Again, since reporters asked this, we thought we'd give you a few more snapshots. Last week, 81 patients transferred out of state for their hospitalization. Only 2 patients transferred in. New Mexico tends to be the tightest hospital bed state in our region, and that creates significant problems. And this isn't just for unvaccinated New Mexicans being admitted for COVID, or even vaccinated patients being admitted for COVID, which is much less frequent. This is for everyone. When hospital beds are full, they're full for everyone. Next slide, please. And then just those statistics, 77% of cases in the past 4 weeks in vaccinated people, 23% in unvaxxed individuals, 85, almost 86% of hospitalizations in unvaccinated people, and over 90% of our deaths are occurring in unvaccinated people. And that middle orange segment of the graph is our problem right now, is the large number of people being hospitalized who are unvaccinated and overwhelming our healthcare system even further. Next slide, please. This is a story about a woman and her parents who were vacationing here in New Mexico. You'll hear her tell the story, so I won't repeat it. And why don't we, Brianna, just cut to that video and show this news clip.
This is Ken Early of Oklahoma City, Elizabeth's dad. Ken's family and Ken were in Taos, New Mexico with the family for a vacation when he had a heart attack in the middle of a supermarket there.
I saw my mother kind of, flagging me down, and my father I could see on the floor.
Elizabeth Kaliopoulos rushed over to her father.
I immediately went in and did CPR.
Were you performing CPR on the floor of the supermarket?
Yes, yeah.
The ambulance arrived and rushed Ken Early to the local hospital, but everyone quickly realized the rural hospital didn't have the capabilities to care for Ken's dire condition.
The idea was, let's get him medevaced to Oklahoma City. That was what we had to do. And no hospital rooms, not one ICU bed that could take my dad.
They tried other states.
They looked in New Mexico. There was not a single hospital bed, ICU, that could take my father. In Kansas, nothing. In Arizona, nothing. In Texas, nothing. Then his condition started to worsen. He started getting a fever. The morning at 8:30, the doctor just came in to the room with that look on her face where you just know, that it's bad news.
Ken Early, a beloved husband and father, a retired CPA who loved to travel and wear funny socks, passed away in Taos, New Mexico.
And it's heartbreaking to me. I just feel like we're in some kind of human crisis because people will not get vaccinated, because people will not wear their masks. This happened to our family.
In the past month, according to the state health department, more than 90% of hospitalized COVID patients were not fully vaccinated.
My father was vaccinated. My mother was vaccinated. My husband and I were all vaccinated.
Elizabeth telling me taking COVID precautions could also be freeing up a hospital bed for someone else, like her dad.
And if you care about your neighbor, if you care about your parent, your grandparent, please just get vaccinated. Maybe my father would have died anyway. Maybe he would have died in Oklahoma, but he would have died in Oklahoma.
And Elizabeth says that is what her father would have wanted. Now, I want to show you all of these numbers here. At last check, out of all of our 4 major hospital systems in the metro, there are 3 available ICU beds. We asked all of the hospitals about the current state. SSM told me it is not uncommon to have 50 transfer requests on their waiting list and more than 24 already holding in their ER. Guys, back to you.
Okay, thanks, Brianna. We can go back to the slides. I would echo the comments of the daughter, Elizabeth, here as well. We have hospitals who turned away over 70 requests for transfer in the past week, a single hospital, and it's not an Albuquerque hospital. It's a rural hospital that acts as a catchment and a higher level facility for their region. So we really are in gridlock. We really are in a crisis situation. We should remember our healthcare workers and out of respect for them, really seriously reconsider if we're not vaccinated, getting those shots. Next slide. How are we doing with New Mexico hospitals? We're doing pretty well. The line here, not the bar, but the line shows you the percent of hospitals reporting. And through earlier this week, we dipped a little bit below. We only have 50 or so hospitals in the state. We had 5 that did not report this week, so just a little bit up below 90%. But of the ones that reported, 89% of New Mexico's hospital employees are fully vaccinated. 3% are partially vaccinated. Those exemptions that are approved, and they're done by the hospital institutions themselves, they provide approval, 7%, and 1% remain unvaccinated. What are hospitals doing with those? Many of these folks are actually using up their paid time off, and once that runs out, if unvaccinated, will actually be dismissed from their facilities. So 99% of folks either vaccinated or with an exemption is pretty good. And now, after this grace period, letting people adapt to and set up their reporting systems for getting this information to the Department of Health, we are sending out letters today fining, I believe, 5 hospitals in the state for non-reporting. And so, but overall, it's a good report. And most hospitals are reporting, and of the 5 this week who didn't report, 3 of them actually had been reporting regularly. So we'll circle back with them. And the fines, I think the first instance of non-reporting is $1,000. The second instance is $2,000. The third is $5,000. The vast majority of our hospitals have figured out how to do this. And so we will be working with those non-reporting hospitals to report, and the fine can be waived if they get their data to us immediately as well. Next slide, please. Unfortunately, these numbers of deaths continue to get added week to week. You will recall that August 23rd, when it was 12 deaths, maybe Brianna, you could point to that, when it was August 23rd, yeah, it was 12, and then it went up to 22, and then it went up in the 30s. Last thing it was the 40s. So death certificates come in later. They need to be processed by doctors and funeral homes, sometimes hospitals. And so unfortunately, the death toll rising significantly. Those numbers are on a weekly basis, a new paragraph. And these are only deaths from COVID. It wouldn't count the gentleman we saw the video about who couldn't be transferred because he did not have a primary or secondary diagnosis of coronavirus infection. Next slide. Treatments, a little bit of new news on the horizon. We continue to do well on the left with remdesivir, which is what we give to people admitted to the hospital, an anti-COVID medication. And those numbers of treatments vary almost directly with the number of patients. And the treatments are the number of actual treatments. So an individual case, I think it's either 5 or 9 overall treatments. So most folks in hospitals now are being treated with remdesivir. On the right, you have 2 of the monoclonal antibodies that we're now using in our state, what we call BAM-EDI combination. We call it BAM-EDI because there's no one in the state who can pronounce both of the names of the drugs, including me, and then Regeneron. And you can see we're keeping up treatments. I would like to see those treatments higher. I'd like to see every person with symptoms who's over 64 or is overweight or has a risk factor. I'd love to see every single person treated. That's something we can do to drastically lower our hospitalization rate. We'll lower hospitalizations by as much as 3/4. Next slide. I did want to give a shout out to a couple systems that have been notable, and I'm sorry we're late getting this data to you, but in particular, these 3 hospitals have really been leading the state. Presbyterian, it's their whole healthcare system, and there's a whole team of people working in their hospitals all over the state that includes Dr. Denise Gonzalez, who's been on this press conference in the past, Aaron Pierce, Jennifer Ellis, Elizabeth Holgan, Stacy Dalton, and I won't pronounce this one right, but I believe it's Tanya Yellick. And so thanks to all of you who've worked so hard to give life-saving treatment, hospitalization saving treatment to many New Mexico patients in order to fundamentally prevent them from being admitted to the hospital. David Shaw out at North Lee Hospital in the southern part of the state, much, much smaller hospital, doing a yeoman's job of delivering BAM. He tells me that Alondra Hayes is a nurse that stepped up to the plate, ran this program, and they've had great success and really strongly believe it has enabled them to get through this COVID crisis by reducing the number of people. And lastly, and I don't have names today, but we'll do it next week, Gerald Champion Regional Medical Center, also one of the highest groups in terms of antibodies delivered last week. We thank you. Some of you may think that I'm trying to get a competition going here between hospital systems to get their names on this list. And if that worked, then I'd be glad to admit that I had done that on purpose. Next slide. We got a couple questions in advance. Thanks to those of you who send them in advance. There's a new drug, molnupiravir. I practiced that extensively in the last hour. It comes in pill form. This is really, really big news. It's currently in phase 3 trials, which is the last phase of a research protocol. So that's good. And their manufacturer claims that hospitalization and death risks are reduced about 50% for mild to moderate infections. So not as good as monoclonal antibodies, but it takes the hospitalization risk down from about 14% to 7%, but still good, and it's a pill. So this could be something that many of us could just have immediate access without the need of an IV or subcutaneous injection. The makers of this drug say they plan to submit it for emergency use authorization against, again, no published study data. Unfortunately, sometimes we have to manage what's new and different in COVID treatments or vaccines by press releases. We always take a look at the data ourselves before okaying it for New Mexicans, but this could be a real breakthrough in terms of on-the-ground treatment for people who have get tested early, find out they're positive, and the criteria for treatment have not yet been vetted, so I don't have those. It may be similar to BAM, it might be a broader group, but it is for people, I believe, with just mild to moderate symptoms of COVID. Next slide. So closing out here, and I know we've run long, I predicted this would take an hour, and that's where we're at. We're still dealing with Delta, 100% of cases. It's at least twice as infectious. So we all need to be at least twice as careful, if not 4 times as careful. Get tested, get treatment, really be careful indoors. Don't yield to peer pressure to take those masks off indoors. Keep them on unless you're in your own home. The highest rate of spread of COVID right now is in these indoor settings. And please, for the sake of our healthcare workers in the state of New Mexico, please get vaccinated. I've just talked to too many people that say as soon as this curve comes down, they're stepping back from their whole healthcare career. They just can't do it anymore. And as New Mexicans, it's important we invest in the health of our healthcare workers and the sanity of our healthcare workers. So please step up, make that, go online, register for a vaccination today. And with that, I think I'm going to turn it back over to you, Hannah, to field questions. Remember, Ricky Cerna is here today, and he says he would be delighted to answer questions about unemployment, and he's counting on you not to ask too many hard ones. But I told him he should not count on that because you do such a good job asking us a lot of hard questions. So with that, Hannah.
Thanks, Dr. Grace. All right, thanks to all of our principals. And as usual, we'll take questions the order in which they appear. So please raise your hand if you'd like to ask a question. When I call on you, if you wouldn't mind just repeating the name of your outlet so our panelists are aware of who's asking and where you're from. And as a quick reminder for those who might be newer to our conferences, we're not going to limit things to 1 question per person. So we will cycle through multiple times as needed. Please just do ask 1 question at a time to allow our principals to focus and to offer a clear answer. So with that, we will begin with Susan Montoya Bryan, followed by Julia Goldberg, and then Dan McKay. Susan, you should be able to talk and ask your question.
Hi, yes, good afternoon, and thanks for taking the time to talk with us today again. And my first question is for you, Dr. Grace. I think you can answer this. You noted the Delta plateau, right, and the high level of community spread around the state. And I think, in fact, that's higher for some counties than last. So can you talk to us a little about the increasing number of infections among vaccinated people? I see the latest report shows that we now have up to 23% of cases in the last 4 weeks, and that's up from the 14.8 reported last week. So that seems like a significant increase. Tell us what's going on there.
Yeah, those are all great topics, and I'll take them one by one. I should have said and didn't say that in particular, that plateau is not just necessarily a plateau across the state as you observed, and particularly in the Northwest where the hospitals are really overwhelmed. We're seeing a significant uptick. Other areas of the state either flat, but nobody's really going downward. Second, with respect to the Delta variant and what we're seeing there, I think that it is more infectious, and there is a mathematical model about the more people you have vaccinated, the higher a percent of people who have COVID will be vaccinated, just because there's now almost, if you think 1 shot, there's 4 vaccinated people for every 1 unvaccinated. So if you compared the rates of disease, it's actually quite a bit higher in unvaccinated people, being 1/5 of the population versus at least the vaccinated group, which is smaller. So mathematically, we'll see that go up. Also, and I'm not going to bring up the curve on the screen today, but the curve is choppy. It is not settled down the way we'd like to see it. So we see these 14% and these 23%, but it tends to go back and forth. So I can't really comment on just the difference between 2 weeks, but I will tell you, we watch it really, really closely as well. I think the important thing also we're observing is that we're seeing a lot of relatively otherwise healthy people in the hospital with who are unvaccinated with COVID, and some generally much sicker patients. And this is anecdotal information from our hospitals, people who are already sick, who may be the ones with weakened immune systems who are vaccinated and have acquired the disease. So there's still just an overwhelming imperative to be vaccinated if you want to protect yourself, your family. Kids in New Mexico, we now know have been protected by adults in New Mexico being vaccinated. So I don't know if I covered every one of your questions. I dropped my pen on the floor and I was trying to write them down, but if you have any, if I didn't, you're welcome to remind me.
And can I add something to that?
Sure,
To your
of course.
response? Okay, so the other thing I wanted to add too is that, it's also that, we have a Delta that's twice as infectious, right? And we also have more people like not masked. And so it's the same as that, like, I don't know, some people have said it's like a hurricane kind of analogy, so that when, even if you're vaccinated and you go into a whole crowd and there's tons of people with COVID, you will still have a breakthrough case. The important thing though, and can I just share my screen from the vaccine data set slide sets? This piece about, vaccine cases, like this is from September 27th, but just showing that even though you have some breakthrough cases, you're still having a reduced rate of hospitalizations and death. And that's really what the vaccines are most effective for helping us to do, is preventing hospitalizations and deaths. So even though there's some breakthrough cases, it's also the other pieces of, COVID opening up, there's like state fair, there's balloon fiesta, there's different things going on that can sometimes overwhelm, your system. So
I also thought of one other thing that we haven't talked about here yet, so it might be worth bringing up, just a theory, but it's a theory that some of the booster recommendations are based on. And that is that the vaccine efficacy may decline a little bit over time, which is why we need a booster. Remember, New Mexico came barreling out of the gate. We vaccinated, we were #1 in the country for a really long time. So it makes sense to me that one possible explanation, I don't have strong data for this, is that we're getting to the end of that 8-month, 9-month period where maybe where a booster is needed. And so we'd expect to see, if that's a factor, we'd expect to see more cases in vaccinated people sooner than other states because of that, because we did such a great job from the very beginning. I mean, as an example, you can divide the time we've been vaccinating people into 2 periods, the first 5 months and the last 5 months. And at least for Pfizer, 68.5% of the second doses we gave were in the first 5 months. So more than 2/3 in the first half. So not sure about that. I think there'll be more data that'll come out over time, but that could be a factor as well.
All right, next we have Julia Goldberg. Julia, you should be allowed to ask your question now.
Thank you, Hannah. This is Julia Goldberg from the Santa Fe Reporter, and thank you for taking my question. I wanted to follow up on the emergency authorization request for children ages 5 to 11. 2 quick things. If it's being utilized under emergency use, would New Mexico's immunization exemption statute for schools be applicable? And if not, Dr. Strace, I'm wondering if you anticipate there would be a public health order that sort of spoke to that issue. I've noted that the number of parents seeking that exemption for other vaccinations has been on a pretty steady rise, and I don't know what sort of indicator that gives. I know you showed the statistics, Dr. Patahon. I think they were national statistics from the Kaiser Foundation, but they went by a little bit quickly. But I didn't know if you thought New Mexico was sort of in similar, or if we might have a higher rate of lack of uptake because we've seen that increase in exemptions. I hope that makes sense. Thanks.
No, it does. Laura will probably comment on this as well. I think, I only know, there may be more, but I know that I've heard that Los Angeles County has made vaccination mandatory in schools for eligible students. But I think the exemption rule would apply there. New Mexico laws would continue to apply. Exemption status would continue to apply. I can't see our state mandating something and removing exemptions allowed for matters of conscience in the law. On the other hand, I think all of us want to do everything we possibly can to make our schools as safe as we possibly can for our children. And so I think, so for example, we would not likely, and I haven't had a conversation with the governor about this, but our past history would indicate that we wouldn't mandate vaccine for kids returning to school, for example, in the fall, if it was still on EUA status. And I think that decision-making process to decide to add a series of COVID vaccinations for school-age kids would go through the same rigorous data analysis and evaluation and decision-making process that the relatively long list of other vaccinations that kids have to get into school has gone through. So I don't anticipate preempting the way we do things for the new COVID vaccine in kids. But boy, we will be strongly urging every parent and every child to consider the vaccine. Laura.
Yeah, so I do have an update on, thanks for all your questions, Julia. They're always really hard and good. So let me just share with you the update we have on the vaccine exemptions. Actually, we had that in our provider call today. People had asked that question as well last week. So the update is that the DOH doesn't provide any medical or religious exemptions for the COVID-19 vaccine. We only provide, our immunization program only provides exemptions for school required vaccines. And then individual employers need to develop their own process for medical or religious exemptions for the vaccine. And sometimes providers may be called on to provide those exemptions. And then regarding the EUA process, I'm not sure the question was about whether or not the EUA would, you mean the actual process would cause people to want to get vaccinated, or I'm sorry, can you clarify that question?
Sure. The last time I looked, the number of parents that have been requesting exemption for school vaccinations had been on the rise. And I was curious if you anticipated that was sort of a predictor of how parents might feel about one under an emergency use authorization, and how, in fact, that state statute for students intersected with a vaccine under emergency use authorization, because I'm not seen that happen before.
That's a really good question then. So we did look at that. We did look at vaccine uptake before and after, like once the EUA turned into not an EUA and when the FDA was fully approved. And we really didn't see much difference in uptake on that. We kind of have this feeling that maybe parents aren't looking as closely at the EUA as we thought they would, not really sure. But what we found is that most of the parents that we are talking to are really concerned about the safety and efficacy data. And then if you look at, can I just share my screen again for like how they do this, the whole process? If you look at this whole process of, if you look at the whole process of, now where did that go? Okay, here it is. If you look at the whole process of how the EUA even gets processed, with first the recommendations by the Vaccine and Related Biological Product Advisory Committee. You have to do a whole bunch of scientific safety and efficacy trials in order to get to this point. And then the fact that then you have to get it reviewed by the FDA, and then the Advisory Committee on Immunization Practices, and then the CDC, and then the Medical Advisory team, I think that, the New Mexico one, I think that it's a reassuring thing for us to say, these vaccines have to go through really rigorous safety and efficacy trials in order for them even to be considered. So I think that if there is a key message out to parents, is that these are really well studied. And then now with millions of doses being given for 12 to 17-year-olds, right, we have a lot of safety data.
Yeah, one promising sign too, Julia, is we're over 80% of adults now, 18 and over, have had a shot. And that's a lot higher than some of the, some of the vaccine exemption requests, -1. So I think we have a shot, sorry for the pun, we have a shot at a higher vaccination rate for kids because of this. And I think the other thing, there's my favorite proverb is a Mexican proverb, and it says, the bull always looks different when you enter the ring. So I guess I'm not as interested in what parents think they might do if a vaccine becomes available. I think once the vaccine becomes available, all parents are going to have to work with their kids to make this choice between the benefits and, the upside and downside of getting the vaccine and the upside and downside of not getting the vaccine. So I think it's nice that the data is trending, that whatever it was, 28 to 33% or something, we'll get it right away. But I think we'll get different data when the vaccine is finally approved for use.
Thank you.
All right, next we have Dan McKay. Dan, you should be able to ask your question.
Hi, this is Dan with the Albuquerque Journal. Can you address, given the plateau in cases and the situation you described in hospitals, whether any of you anticipate changes in the public health order, the one that outlines mask mandates and so on? I think that it's due to expire at the end of next week. Thank you.
That is correct, Dan. A great question. The order is set to expire. I think there are two factors here. One is on the helping the hospital side. We've been talking and debating about the declaration of crisis standards of care for a couple weeks. I think when we thought we were going over the peak and then coming back down, we'd make it through. But that plateau that we're in right now is clearly calling that question again. So we're discussing that. I think in terms of suppressing, adding additional restrictions to change behavior to try to reduce hospitalizations. It's funny because the vaccine itself is such a potent tool that it would take an awful lot of other things added up to get even halfway there. And I think we've talked at these press conferences about, and I think the governor would agree that what we really need to figure out is longer term solutions to manage this pandemic, things we can live with for a year or two or three, rather than flicking on-off switches for the mandates. I would love it. And then the last thing is, we have a mask mandate for indoors, but, it's not like everyone is doing that. So I'm not sure that additional mandates would add all that much when we don't have New Mexicans following the most scientifically proven, basic, effective, things that every individual can do short of vaccine. So I'm sort of painting a picture on both sides, and that's because I'm probably in the middle on this right now. We're just continue to call on all New Mexicans to do what it says in the existing public health orders and to be vaccinated. So I don't have a preview of coming attractions for the public health order for next Friday, but at this point, but we always talk at length about are there things we could do that we think would make a difference.
All right, thanks everybody. And then I just see Robert. And then if anybody else who's already asked a question would like to ask again, you can raise your hand. Perfect, Julia. All right, so Robert, go for it.
Thank you, Robert Knott, Santa Fe, New Mexican. Thank you for doing this, Hannah. Thanks for helping me get on board, and it's good to see you all. I have a couple of questions. I don't mind you circling back if others are waiting. I guess I'll throw this at Dr. Scrace. I can't speak for we. I want to say we see, we think, but it's just me watching this like we all are. But I'm just wondering, when you look back, where are we 19 months into this pandemic compared to some of the highs and lows before? Because it still seems like, well, you said the word crisis, it still seems like we're in trouble. I'm sort of trying to get a sense of where are we right now in your view? Are things as bad as they've been when they were at their worst?
Yeah, that's a great question. And I think our epi curve, and maybe Brianna, you can bring up that standard epi curve slide on the screen, is a little misleading because it looks like if you squint at it, we only have half the number of cases now, or a third that we had when we were at our peak. But things have fairly drastically changed. One, we have a lot less nursing staff available in the state than we did before. And that is an enormous rate limiting factor. So, somehow we got through that week with, 1,800 cases or more. But right now, we've got in this much, much smaller peak, one, less nurses, two, a lot more people in the hospital, sicker people in the hospital. And there's a way to measure that. And our hospital partners tell us, called case mix index or acuity index, that case mix is the highest it's ever been. And we believe that a good part of that, although we don't have hard data, is from people who delayed care for diabetes, heart disease, lung disease, high blood pressure, whatever it is, delayed that care and now developed complications as a result. And so I think Mike Ciccarelli, who runs our hub and spoke hospital meeting, said on Tuesday it was the most difficult meeting they'd ever had, and that folks are really frustrated and exhausted. And I do think there's that psychological element of the first wave where you're fighting back this horrible pandemic viral infection that's killing people and hospitalizing people. And you really don't have too much in the way of treatment or prevention. And now with vaccines that people aren't taking and preventive treatments like monoclonal antibodies that people aren't taking, that's very, very frustrating for healthcare workers. Preventable disease is more frustrating. And so I think I would say those are the factors. And then, the other thing to think about that I think about a lot is there's this whole science of crisis management, what they're doing in Louisiana with hurricane damage, what happens after a plane crash. But those efforts last from a couple days to a couple months. And nobody for 100 years has had to go through, an 18-month crisis like this, least of all hospital administrators. And that you can only kind of encourage people so much to hang in there and, imagine that after 18 months. And so I understand. I've got some people I really respect deeply who just don't feel like they can continue doing this physician work or nursing work anymore because of the relentless nature of the strain. So I think if you asked our hospital leadership, they would say it is as bad now as when we had twice as many cases in the hospital, because we don't have room for the ones who we're taking care of now.
Thank you. I have follow-ups, but I can wait.
Okay.
All right, thanks, Robert.
Hannah, we
sorry,
need a question for Ricky Cerna. I mean, he presented all those slides and somebody must want, we had some reporters here who covered the economy. This is sort of the doorway to rebuilding an important part of our economy. So just a little pitch. Julia, you don't have to ask an employment question, but I think Julia is next.
Yep, Julia, your turn. Go for it.
Okay, I apologize. I don't have an unemployment question at the ready. I was hoping I could follow up with Dr. Patajon for something you explained last week that I didn't understand at the time and felt confident I would be able to figure out in the interim, but still don't understand. And it's from the weekly vaccine equity report, page 24, where it shows the geographic vaccine disparity. And you're muted, Dr. Patajon.
Laura, I can bring that up for you so you don't have to do it.
Oh, okay, great. Thanks.
Okay. So the explanation for how to read those slides, and I just want to make sure I understand it so that I can translate the data, is that the example is given for San Juan County that the share of vaccination for Native Americans is 23.3% higher than the share or proportion of the population. So when I look at the state vaccine dashboard, 71.9% of people in San Juan County are fully vaccinated. The Census Bureau indicates that about half of San Juan County identifies as Native American. I still don't understand what 23.3% higher than what, than 50% of the population? Is that what that's saying? And how does that relate to the 71.9% who are vaccinated? Sorry.
Yeah, no, it's okay. It's I know it's confusing for us too sometimes. So basically what that chart does, it takes the cumulative share. So like I wonder if I might have a something I can pull up for you that actually has the actual numbers. So what we do is that we take the numbers of like everyone in San Juan County who has been vaccinated, right? So let's say there's 100 people who are vaccinated in San Juan County, but it's 50% of those people are 50% of the people are Hispanic in that county, right? And I'm just making it up, but like maybe what I'll do is can you come back to me? I'll actually pull up the actual numbers because I think that helps a lot to have you understand, like, and it helps me to understand too because it's the numbers. But it's actually that cumulative number is like, so if more people who are Native American get vaccinated, right, versus Hispanic or white populations, then that means that the cumulative share of the vaccine will be more for people who are American Indian. Does that make sense? Or Native American? Does that make sense? Maybe I'll pull that up. I'll come back to me. I'm going to pull that the actual data up.
Okay, thanks.
Julia, the way I think of it is a positive number is good. We're winning the war on healthcare disparities in the state by really getting to race and ethnicity groups that have been under vaccinated.
You said that last week.
Okay.
You said that last week, and you said that the color, the darker the color, the better of the math. I just was trying to understand what it meant for something to be 23.3% higher than the share of something. And I thought if I looked at raw numbers from the census, I would be able to then do the math, but I couldn't.
Good try, though.
All right, next we have Susan. Go ahead, Susan.
Yes.
Susan, you're on mute.
Sorry, Susan, I tried to unmute you at the same time.
All right, there we go. All right, this question is actually for Secretary Cernum. So, we know every job in New Mexico counts, right? And I noticed there were a lot of postings for healthcare in particular. So what kind of conversations were had at Workforce Solutions about the folks that are going to lose their jobs due to the vaccine mandates? Are there any particular things that the state is looking at and trying to get them placed, or just tell us a little bit about how those discussions went? Thank you.
Thanks for that, and for responding to David's plea here for a difficult question. At this time, we have not tracked that information. So we've not collected information on what the impact to vaccinations and testing requirements has been for healthcare providers. But certainly, it's definitely of interest of ours to understand where placement will occur, not only immediately, but following the public health orders. We certainly want to ensure that these workers, primarily in healthcare, where the need is high and has been high for many, many years, pre-pandemic for sure, so that they don't leave the state of New Mexico and they continue to practice here. It's the question really does drive an interest now for us to understand what the impact has been, and certainly ensuring that there isn't going to be any relocation outside of the state to do that. Although it's becoming increasingly difficult to work in that field without being vaccinated or testing on a regular basis. So we're hopeful, of course, that the impact is small, and that it's something that we can turn around very quickly after those requirements are lifted.
All right, thanks so much. And next we have Chris McKee. Chris, you should be able to ask your question.
Okay, I think you guys can hear me, so thank you very much. I also had a question for Acting Secretary Ricky Cerna. This is in relation to just the raw total unemployment numbers. I think anecdotally we heard in a lot of the months and weeks leading up to the sort of expiration of benefits that once those benefits expire, people are going to come rushing back into the workforce. And I know you did present some data there, but I guess I just wanted to generally ask, is that really what we're seeing? Are we seeing this sort of rush back to work? And if we're not, maybe why not?
We're having discussions with employers to really understand that. As I mentioned yesterday, we had discussions with hotel and restaurant owners, and certainly they would answer that question this way. They still struggle to find the workforce to come in and work, even though they've made several attempts to add additional perks, from healthcare benefits, healthcare consultation resources, to increased wages. So certainly we're coming up with creative solutions that address what we understand are some of the barriers to why New Mexicans and I think workers across the nation have yet to return at that rate we all anticipated. They include barriers with healthcare. Of course, the public health orders still pose a concern to a lot of workers who are waiting until they feel as though it's safer to return to the workforce. There are barriers related to childcare that we're working with ECD and our colleagues there to really identify where those childcare deserts are in the state, how we can create some toolkits to really help those communities ramp up in their ability to provide childcare assistance to workers. And we also know that the pandemic, which prompted a tremendous amount of telework, is really creating a lot of different options for workers, or at least the desire to work in a very different setting that they did previously. So that coming with that third barrier is the opportunity for a lot of workers to explore career opportunities outside of the state without having to relocate. You may see now a number of employers outside of the state of New Mexico offering work opportunities remotely to individuals across the nation. And that of course is playing itself out as a barrier for a lot of workers who right now can't provide those telework, remote, or hybrid opportunities to workers.
All right, thanks so much, Ricky. And I know, Robert, you said you had a couple questions. Yeah, you wanted to ask?
Yes, I do. Thank you. This is sort of a question for Dr. Scrace with the hope that Secretary Cerna will follow up on it. Earlier, Dr. Scrace, you mentioned to Dan McKay and therefore to all of us that we have to be ready for a 1, 2, 3 year plan for managing the pandemic. Could we be looking, as we've often all told ourselves, this will be over by July 4th, by Labor Day, by Christmas, name your holiday. Could we be looking at a 1, 2, or 3 year continuation on some level of this pandemic? And if that is so, sir, I'd like to hear from Secretary Cerna. Is Workforce Solutions ready for that continued discussion for adapting to more unemployment or more job vacancies galore? Thank you both.
Well, just for the record, I started predicting that the pandemic would be over, when it would be over in May of 2020, because you all kept asking. And I said September 30th, 2021, and it's not over. So that's number one. Two, which means you can't predict it. And I think had it not been for the Delta virus, the Delta mutation, we might be in a completely different place right now. But the trouble is the virus is fighting us. It mutates, it evades either treatments or vaccines or other things over time. And so we have to keep up the fight. I think people in 1920 when the great influenza pandemic that killed tens of millions of people worldwide was over, people thought, well, thank goodness we're done with influenza. Now here we are, 102 years later, 101 years later. I got my flu shot a couple days ago, and I get one every year. And so I think that annual flu shot is an example of a way we as a society have learned to live with COVID. So I'm looking for a middle way that gets people back to work, but maybe they do wear masks at work to reduce their risk, or reopens as much of the economy as we can, but we all exercise greater caution to stay in balance. And I don't think anybody knows. I mean, to specifically answer your question, I mean, basically what we're saying is, how much longer are we talking about here? I mean, if you'd asked that question 101 years ago, probably no one would have answered 101 years for influenza. And so we just don't know. But the virus clearly has the ability to mutate. That's what viruses do. It mutated into a much more infectious variant, which is now infecting vaccinated individuals. And so I think it will be a series of, if you will, punches and counterpunches between the virus and the rest of the world trying to get this under control. But I don't think we can, I said a few weeks ago, we have to figure out what we can live with for 2 years and what we can't live with, for a couple of years. Like, I don't think we can live with remote learning for 2 years. But, maybe we could live with indoor masking. I mean, I just don't know. We have to wait and see. Maybe we can live with more employers requiring vaccination just because they want to be successful employment workplaces and make sure their work environment is safe for everybody coming back to work. So I'm not sure, but I do think we have a longer road ahead of us. And that's why I think we're trying to rethink in terms of a long-term strategy rather than a day-to-day or week-to-week or month-to-month, mandates on, mandates off type of an approach. Thanks. By the way, we had a long discussion about this at modeling team, like a very long discussion about that exact question yesterday with some really incredibly smart modelers and others. And I think I represent the opinion of the group in general that we've got, this is going to stretch out for a much further distance in front of us than we originally thought.
Robert, thanks for the question. I think there's two pieces for us that we really got to understand, and in two spaces that we need to anticipate in. And I think even the pandemic aside, this is going to change the workforce or the way the workforce operates for a really long time. And so what we're planning for is, conversations. How do we engage sectors of the workforce to really understand the changes that they've made and how that's going to impact their need for workers, how workers need to be trained, and how they're going to be provided with work opportunities. There was a lot of automation that took place that's going to reduce the need for certain workers in some industry. There was adaptation that occurred that's going to change the way workers intersect with customers or with stakeholders. So I think this is the start of a lengthy conversation about wages. There's no question that the pandemic has really done something to wages that would really occur over a period of time, and what kind of risks that's going to present, to employers on all sizes. So we're having those conversations, and we know that it's going to be a long road before we really truly get everyone on the same page about how we need to operate in terms of workforce development. In terms of benefits, we've been having this conversation for a long time. There was always a thought that perhaps after September or sometime before September 4th, that there'd be benefit extensions that could come our way. So we were ready. We've learned a lot about service, about communications with our constituents, about fraud prevention, staffing, you name it. I think the learning curve was steep, but surely we've done a lot of reflection about what we would need to do if Congress were to approve measures that provided additional benefits to New Mexicans. And I think we can do that without as much, chaos that occurred early on. which really did stem from a very robust and quick uptick in claimants. So we're having those conversations. We're paying attention to what's happening on a national level and learning from what other states are doing and finding out about economic recovery. So we believe that we can adjust and pivot very quickly.
Thank you, sir. Can you confirm the number of job openings right now? Was it 80,000?
Right, we were looking at over 80,000 openings, I believe is the number.
Thank you. I have one last question if I can go, but I will wait for others if they want to.
Marilyn has her hand raised there, Hannah.
Marilyn, why don't you go ahead and ask your question? You should be able to share now.
Hello, thank you so much for taking my question. I know that you touched on this earlier. What is your thought about the new COVID-19 treatment pill? And will New Mexico plan on using this? And it's said to be the only pill used to treat COVID. Is that true? Thank you.
So right now, there are 0 pills that have proven to be effective and approved by the FDA to treat COVID. And we spent an awful lot of time in the last couple of weeks talking about other pills people are taking that are not approved by the FDA for COVID treatment. The way that the approval process works with the FDA is that the pharmaceutical companies keep this data highly secret, and we have no access to it. And then they release these press releases that say, they had 1,500 people in the trial and hospitalization rates decreased from 14% to 7%. But the FDA doesn't approve drugs based on press releases, and it's very similar to vaccines. They will go through that process for the EUA. I think that assuming that the federal government goes through its processes, it will be relatively easy for the MAT to approve the drug, and we would encourage its use. Just the simplicity of taking a pill rather than an IV injection is very attractive and much easier to get across the finish line. There's some talk about states distributing the medication rather than the normal supply chain, which usually signals that they don't think they'll have enough supply, which is unfortunate, but we'll see. So we have our fingers crossed. It would be great to have a highly effective treatment that people could take if they did develop COVID. We don't know what the criteria for treatment are because that wasn't in the press release. They said mild to moderate COVID. So once we have the data, which won't really occur till they apply for the EUA and then it becomes a public document, I can't tell you too much more, but I love the idea of having a pill that people could take for really early treatment for when they get a positive test. And if they meet the criteria for the treatment, which we have no idea what those are just yet. Thank you. I think, Laura, you've got a follow-up answer to Julia's math question.
I do have a follow-up math question answer. So let me pull that up for you, Julia. I had to do some quick math right now to answer it, but here we go. See, I hope this answers your question. So let me give you a slide here. So I put the maps on here so you could see this. So this is the San Juan disparity doses. And actually, I'm sorry, I probably didn't match up the exact map date with the date of this, the actual numbers, but I think you'll get the idea here. So here's San Juan County. And then this is, oops, sorry, here you go. This is race ethnicity here. Here's the total doses of vaccinations given by the date of 10/4/2021 for the San Juan County. This is the total doses, the purple are the total doses administered per ethnic group, right? So for American Indian, Asian Pacific Islander, African American, Hispanic or Latino, and white. So then this is this data, and the percent of vaccine to each racial ethnic group is D, which is the total administered doses here, divided by the total doses. So here you get 62% for American Indian, so on and so forth here. Then we then look at the percent of population in the racial ethnic group. So that's F divided by E. So the population by race 12 and over, and the county population 12 and over. And so then you get these numbers here. So let's just look at American Indian numbers. So that's 62% minus 39% is the disparity, what we call the disparity number. And in this case, out of all the doses that were given, the majority of people who got the doses that were over the whole group is San Juan American Indian, 23.4% difference. And then let's just look at Hispanic or Latino populations. That's negative 10%, because that's the 8.89% minus the percent of the population who actually could get the doses. So ideally, like, everyone would get the same amount of doses as their racial ethnic group. But in this case, more people of the doses that were given, more doses were for American Indian. And so the way we use this map is to really look at, so in San Juan County, American Indian populations are doing great, so we don't have to worry as much about that group. IHS has done a great job building trust, and the tribal leaders have done an amazing job also building trust in the population to get vaccines. But here we know Hispanic Latino populations are at negative 10 difference, and then white populations are at negative 13.56 difference. So we know those are certain populations that we need to work with more in order to gain trust and get vaccinated. So that's how we use the map. I hope this explains it.
It does. I think I thought that I didn't realize I didn't have raw numbers for county by ethnicity group in the breakdown, because the state gives it just for the statewide. So I think that's where I got confused. Yes, thank you very much. I get it.
Awesome. Okay.
Good job, Laura.
Great job, Dr. P. All right, Robert, I think you still had another question, right?
Yeah, sure. Thanks. Last one. Dr. Scree said that 5 hospitals had not reported employee vaccination rates. Would you remind us how many hospitals total there are in the state? And can you say which 5 hospitals those are?
So I'll answer the second question first, which is no, because we really like to notify them first. And I think there's some hospitals that I wouldn't normally think of as hospitals that are mainly like big urgent cares, but they might have a bed or two. I think the total is it's right around 50, and I can get that number in the next couple minutes and get it over to have Hannah or somebody get it over to you. I want to say it's either 48 or 54, but I know that's kind of a difference between those two. I know it depends on the classification, but I can find that out.
Thank you.
Okay, all right. I don't see anybody else's hands, so I think we will wrap it up for today. But thank you all for your questions, and I will turn it back to our principals to close out if they would like.
Let's start with Ricky. Any closing comments about the labor force, or a message you want to underscore in a minute or less, Ricky?
We really just want to underscore our ready.nm.gov website and initiative. It really is just a true one-stop resource for New Mexicans, both job seekers and employers, to get connected with workforce opportunities they're really looking at. So please visit the site, share broadly, and if you have any questions, the toll-free number there is 800-303-3599. Otherwise, I want to thank you all for your time, attention, and your questions.
Laura.
Hey, hi. So thanks so much for having us again today. It's also always awesome to answer your questions and to learn from you guys. I think we're co-learning as we kind of approach this pandemic, and I think that this is a long haul, and our next step is the kids. So just thanks for all you're doing to kind of let people know the facts and get the information out there so we can get our kids vaccinated and protected as well. So thank you.
And I would just say again that, most of us have a healthcare worker in our extended family or living on our street. You saw the number of job openings, and healthcare is a big labor market in New Mexico. And we really want those younger people to stay in their roles. We want those older people to stay in their roles for a long period of time. They really need our support today and every day until we can empty out some of these hospital beds and make room for you and me and our other family members who may have to go in for an appendectomy or, a blood clot or a heart attack, as we saw today. So please think about that. Think about your own health. Think about what you can do today, whether it be getting a vaccine, wearing a mask, whatever it takes to make room for yourself, if that helps you to think about it that way in the event that you should have a medical emergency. We appreciate everybody's diligence, the great questions. Thanks to our media partners for getting the word out. And if we can just redouble our messaging regarding how much our healthcare workers in the state need our support right now, I think that helps all of them. The messages last week helped, the words that you got out, and they will help again. So thank you very much and have a wonderful day.